this video we will continue our discussion about the tumor associated macrophages on ATF4 and also on the SLIT2. So continuing forward from our previous video, so what they did is they analyze this ATF4 cut and tag method. So basically they treat the cells, that is SSC7 cells and B16F10 cells, with conditioned media from bone derived macrophages, M0 bone derived macrophages or tumor associated macrophages, and thereafter they check the cells with this cut and tag analysis using this ATF4 antibody. So basically they wanted to find out where ATF4 binds so that they can know how the ATF4 regulates in the bone marrow derived macrophages conditioned medium and tumor associated macrophages conditioned medium. And thereafter once they find out the genes that they are the genes of promoter that they that this ATF4 regulate, then they use the GO and KEGG analysis to find out the pathways that got upregulated or upregulated in both the conditions. So in the case of this bone marrow derived macrophages of this M0 stage, they are able to see that two signaling pathways are upregulated, that is ERBB signaling and cell cycle checkpoint. Whereas when the cells are cultured with tumor associated macrophages, and these results are for the B16F10, they are able to see following signaling pathways are upregulated: axonogenesis, neurogenesis, nervous system development, sensory system development, lumen. And so this all indicates that in the case of tumor associated macrophages, it is more aligned towards this neurogenesis, pain, and also the ER stress, since ER lumen is increased, ER lumen pathways are increased. And thereafter they checked its interactions with this SLIT content in conditioned media. Or no, they checked the SLIT contents in these different conditions, and also they checked whether they are ATF4 dependent or not, and they are able to find out that the SLIT2 content is ATF4 dependent in both SSC7 and B16F10, and also it is dependent on the tumor associated macrophages conditioned media. As only these conditions, they are able to see enhanced SLIT2 content in the conditioned media compared to the case where it is the cells are treated with M0 phase bone marrow derived macrophages. So here they made a point that ATF4 and SLIT2 both are dependent on the tumor associated macrophages, and then they did the multiple immunofluorescence imaging to find out the location of this ATF4 and SLIT2. So what they are able to see, that ATF4 and SLIT2 are co-localized, and since they from the previous results they are expecting it is to be high in the case where the cells are surrounded by tumor associated macrophages, that is in the control IgG2A. Whereas when they use CSF1R antibody, where cells are not surrounded by tumor associated macrophages, because it will inhibit the TAM interactions to the tumors, that CSF1R antibody inhibits the TAM interactions with the tumors. So in that case they are able to see reduced ATF4 and SLIT2, and these things they have quantified on the right hand side, where we can see that in the violent plot, when they have this IgG2A or when the TAM is surrounding the tumors, they are able to see enhanced signals for ATF4 plus SLIT2 plus. Here signals are for SLIT2 plus and PANC-CK plus, compared to the case where CSF1 are used, where the signals are reduced. And this is the overall picture, where they can see that the average is around 0.6, whereas this grouping could belongs to the IgG2A control signal, and this grouping below grouping could belongs to the conditions where this SCC7 cells are treated with CSF1R antibody, or not cells, this xenograft. So from these results they made a point that this ATF4 and SLIT2 are not only co-localized but are also dependent on the tumor-associated macrophages and this. So we will discuss, so these are some of the results that are shown in this figure, and we will discuss how this ATF4 and SLIT2 relations with TAM helps in the tumor suppressions in the subsequent videos. So that's all for this video. Thank you for your time.